Hello, my name is Katia Bruno. I'm a speech pathologist here at Vibra Hospital. June is Dysphagia Awareness Month, so we'll devote this video to dysphagia. So what's dysphagia? It's difficulty swallowing for any reason. Could be neurological, like stroke. Could be progressive neurological disease like ALS or MS. Could be something with respiration, COPD or tracheostomy, which is the majority of our patients, or could be something else, even decayed or missing teeth. So it's any sort of difficulty chewing or swallowing. So my little helper here, tracheostomy Tom, he will help us understand dysphagia today. So we eat food and it goes into the mouth. It should be in the front of the mouth, then we will chew, push it back, swallow. When we swallow, the airway closes and all the food goes into the pharynx or swallowing tube and then into the esophagus and the stomach. Sometimes the breakdown occurs and could be that the patient does not close lips really well and the food falls out of the mouth. Imagine a stroke patient or drooling, or it could be liquid leaking out of the mouth, not enough chewing, or and have difficulty pushing the food down and swallowing. We can see pocketing behind the cheeks. We can see that the patient does not chew well, and pieces can go down and obstruct the airway. Could be that the liquid goes down before the patient swallows, goes into the airway, onto the vocal folds, which is laryngeal penetration, or even below the vocal folds, and into the trachea, possibly to the lungs, causing pneumonia. And this is called aspiration, if the material goes below the vocal folds. So why aspiration is so terribly bad? It's because it might cause pneumonia, and it's really bad in our patients because they already have multiple comorbidities, and pneumonia could be just mortal for them. Also, if the patient has dysphagia, it could lead to electrolyte imbalance, difficulty with healing wounds, with nutrition, with getting better overall. So we pay special attention to dysphagia here. What do we do? Speech pathologists will do restoration, which is exercises, electrical stimulation, trials of different foods and liquids, all sorts of exercises, postures. We will do a swallowing study, which is an x-ray of the swallowing function to make sure that the patient can eat and drink safely and nothing goes into the airway causing potential problems. We have people with tracheostomy, like I said, and we work closely with all the team members, like physicians, respiratory therapists, nurses, physical and occupational therapists, to get the patient to their baseline as quickly and effectively as possible. We use speaking valves here. It helps a patient with tracheostomy to start speaking and eating safely. If I put this valve here, patient no longer breathes in and out through the neck, but through the speaking valve and out through the nose and mouth. So if they breathe through the neck, through the tracheostomy, being on the ventilator, or just on a trach collar with the tracheostomy, the air doesn't go up enough to the vocal folds and they don't have any voice. But if we use a speaking valve, air goes in and then up to the vocal folds so patients can phonate and actually verbally get their point across. Before that happens, we make sure that our patients can communicate well using simple devices like communication board and the dry erase board. So we pay close attention not to just swallowing but communication and possibly cognitive disorders. Also, if we go back to dysphagia, we have a dysphagia support group here in conjunction with National Foundation of Swallowing Disorders. You can find us on their website or just contact Vibra Hospital. We have support groups quarterly. So unfortunately, we we had to cancel the last one in May due to COVID-19, but we really hope to be open to our patients and the community on September 18th. So if you or your loved ones have any trouble swallowing, please contact us and we will be happy to have you on board. Thank you so much for your attention.